Good morning, everyone. Welcome back to Tuesdays with Paula. I'm Paula K Bronte, your Master Rapid Eye Technician, and I'm excited to be here in the office of Susan Mclaughlin.
Thank you.
She owns Align. And what's the full name of it? Align?
Well, I have my tags, integration and movement.
Integration and movement. And she is a physical therapist, and really her area of expertise is helping people get out of pain and come back into a place in their bodies that allow them to align with all the aspects of themselves. And I know from my practice working with people in rapid eye that if someone is in pain, whether it's physical or emotional or mental, if we're in any kind of pain, it's almost impossible to really be able to harness the joy and the aliveness available to us. Susan is doing a huge service for us in our community here, and we're going to hear all about it right now. So tell us about what you do and how you came to have your love and passion for helping people relieve their pain.
Okay. Well, the long story short, what got me into physical therapy in the first place was I had my own chronic pain. And actually, no, I want to go back because I had chronic pain even after. So initially what happened with me is, I finished undergrad. I was just dinking around, playing, and just doing random jobs. And I was working for UPS, loading trucks, doing this heavy manual job. It paid great for the time, the time for the little bit of time that I worked. And then at the time, I was living in California. I was not really knowing what I wanted to do post undergrad. And so there was, it was like one of those things where you have this event after an event after event. So I've been doing this labor job, and then I ended up getting in a car accident, and I injured my back. So my back was already bugging, but this was like the event.
Right.
And it was also in a time in my life when I really didn't know what I was, like I was lost. So this is kind of like on the emotional spectrum, this was kind of the perfect storm of not being supported, right? In that low back area. And so I went through my whole path of trying to get out of this pain. And I know pain is exhausting. I went through 2 years of doing conservative management, and I ended up getting surgery. And that worked for me. All of the pain went away after surgery. So magically, I had a clean slate. And what that gave me the opportunity to do was really realize that I needed to take that next step of action. And that next step of action for me was to get into school again. So the plan was to go ahead and get into grad school and get my teaching credential, which is what I thought I wanted to do. So I started taking classes. Now I'm back at the University of Utah, and I realized, holy moly, I don't want to do teaching. What do I want to do? And I've always been fascinated by the body. And so I know that, like for me, I was very physical as a kid. I was very coordinated and athletic. I played lots of sports, and I really enjoyed that piece, and I wanted to be able to understand the body. So I thought, okay, being a physical therapist gave me this niche of being able to understand and to learn the allopathic method and learn about the body. And I was also always very curious about the esoteric. Even then, I was really curious about, the energies that I could feel under my hands, and not even knowing what that was, but I could tell, like, when I was working with people, that I could feel things. And so I was always curious about that. And I thought physical therapy would be this great bridge where I can get this information, and I actually get to spend time with people, because I do have an interest in education and interacting and really getting to know somebody. And I have that kind of helping profession in my line, in my personality, and so that really fit with me. So once I knew what I wanted, I was like, boom, did it. Was able to get into PT school right away, graduated, and started practicing.
Mm-hmm.
And then what happened is once I was done with that action step, pain started
Coming
returning.
back. Mm-hmm.
And this pain didn't go away. This
Was
pain
it also in your back?
It was in my back, but it wasn't similar to what was happening before. And so I lived with, 10 years of this chronic pain. And that's exhausting.
Wow.
I know what it's like to be in pain. And I feel like when people read my story, if they found me on the interweb, is that they know that I've been there, mm-hmm. and that they feel there's some kinship. I have a sense, because it's exhausting.
Living with pain is really not living.
And that's exactly right.
Yeah.
That's exactly right.
And so you healed yourself from that pain?
I did. So yeah. So what happened for me is I was working at one of the big healthcare companies here in the Valley, and I was working in, believe it or not, the spine area. And so I really love this approach, because for me, I see the body as a whole, and I really thought, okay, spine, this is a great area to be in, because I get to really look at the whole system. Mm-hmm. It's not just, okay, you go see someone for your ankle or your knee, and I really felt like I could bring all of that in. So I felt really excited that I was in that area. Mm-hmm. And at the time, there was a lot of transition. They were building the new medical center off of 53rd in the Valley. And so the spine team was going to split up. And they were creating new, the new rehab place for us. And so they had asked me if I would be interested. They wanted to get into women's health. They wanted to get into pelvic health, actually. And so they had asked me, are you interested in going into the niche of pelvic health? And I was like, yeah. This would be awesome. This would be so exciting. Yeah. Mm-hmm. And so I started doing all of the extra training to become a pelvic health specialist. Mm-hmm. And so when we moved over there, that was my niche. Now, learning about the pelvic area is really overwhelming. Like, to me, it was overwhelming, because it was the urinary system, digestive system, reproductive system, nervous system, musculoskeletal. Yeah. So here we have everything in this small little area, right. And no one wants to talk about their genitals. Right. No one wants to talk about pain with intercourse, or leaking all over themselves, or having a baby and having abdominal wall separation, and even men. Mm-hmm. Whoa, everything's blamed on the prostate, and a lot of times what's happening, excuse me, I'm spitting, I'm so excited. What's happening is that there's a lot of tension in the system.
Right, yes, and we don't have no idea how much we hold there. I'm going to just interrupt you for 1 second. And there's a couple of things you've said that, coming from my perspective, the light bulbs are going off. So you mentioned first you started with the lower back pain, right, and not having support. So most of you probably know by now that I work quite a bit with the chakra system in Rapid Eye. And that first chakra right there is that's the sacral bone. That's the cradle that supports the whole system. Mm-hmm. And when we're feeling unsupported, when we're feeling not connected to our world in a way that is fulfilling and makes us feel safe, that first chakra gets crunched and scrunched and blocked and out of alignment. And one of the first things that can happen that shows up is lower back pain. In fact, very often when there are financial concerns, it's going to hit the lower back. So if anybody out there has been having some lower back pain, you've been coming and going, I don't know what this is about, maybe sometimes you'll even have an x-ray and it's fine. Take a look at how the experience and the perception of financial lack is almost like an entity in itself, and it can attack and hit that lower spine in a really big way. And it can start with pain that may not be findable, but then it will start to work away at the bones and that whole system. So that first chakra is really important. And then she moves up, right? Susan moves from the first chakra up to the second chakra, that whole pelvic area, and all those organs and all the system that goes on there. huge. It's one of the biggest chakras that I work with. It takes the most time. Of all the chakra sessions I do, sometimes it'll take 2 or 3, maybe even 4 sessions to get through the whole second chakra because there is so much in it. So I can see why it was overwhelming. And it has to do with creativity and relationship. And it's really our source of joy. We think joy comes from the heart, but it actually comes from that whole pelvic area. It comes from that second chakra. And so when Susan is helping people get out of pain and release that tension, you were just talking about stress and tension, especially how men carry. Women will manifest it more easily, right? Men will kind of deny that it's there, but they still have all that stress and tension. And what it does is keep that joy from being able to be expressed and the creativity, right? Creativity and joy are synonymous. So Susan's doing huge work by helping people clear the pain and get those pelvic issues back in alignment and balance.
Yeah.
Okay, my 2 cents. Go ahead.
Yeah. So I wanted to get as much information as I could, and there was lots of support through Facebook groups, colleagues around the world, and so we had this little kind of chat area where people can like bring in maybe some difficulties with cases. And anyway, so there was a blog going around at the time that was called No More Kegels. So if anyone has ever heard anything about healing urinary leakage or pain or prolapse, the key to everything has always been the Kegel. Now for me, what I found was clinically, there were some people who responded to the regimen of Kegels, and there were people who didn't. So for me also, I'm one of those type of people that I like to practice what I preach. And so I noticed that people weren't responding to the Kegel protocol. And so I thought, oh, they're just not doing their exercises. You know?
Right, they're saying they are, but they're really not. Yeah, I know that one.
Yeah, and so historically, I've never had a child, but I have leaked urine on jumping on a trampoline, a random laugh. You know, you laugh to pee your pants. We all like, oh, I'm laughing so hard. Yeah. Well, that's not normal, and that shouldn't happen, right? And so I was like, okay, I'm going to put myself under this regimen. So the regimen is 100 Kegels a day, and you do different types, you do different loads. And, you know, this is back in 2007. A lot really has shifted in our awareness now. And so I was like, okay, so I did this. I didn't do 100, I did 90, and I did different bouts, and I did this for 3 months. And guess what happened? Nothing. Wow. So to me, I was like, there has to be something else. So when I saw this blog, No More Kegels, and this interview with this woman who I really ate her stuff up, Katie Bowman. She does a lot about really looking at how you're moving and using your body in the day-to-day. So how are we loading it, and how your body is responding is how you've been loading it. So can you take a moment? What do you mean by loading? Like you just said, you're contracting your so that's a load to the system. Okay. Imagine if you're doing that unknowingly all day long. Which is what happens is we unknowingly have these habitual ways of moving and using our body, and this affects our tissues. All right. This affects it's kind of this whole, what happened first, the nervous system or the muscle system? So you mean kind of taxing? When you say loading, is it taxing? Well, yes. But we also have positive loads. Right. You know, we want bone building things. Right. So on the scale of loading, we have, you know, I don't like to polarize things like this is bad. Right. It's a thing that you do. It's a move that you do. It's a load that you have, but maybe you don't want to have that day in and day out. So that's what I mean by varying. It's this whole idea of varying the loads to your tissues and be more mindful of how you're doing it, because there probably is a better way. 98% of our world is on automatic, right? Yeah, it's really high. It's a high percentage. And so bringing in the mindfulness into day-to-day can really change the nervous system and can change the musculoskeletal system and the organs. So for instance, I'm thinking about, with rapid eye, I'm moving my eye direction many hours a day. Yeah. Right? And so it's a repetitive, so I'm loading that shoulder. Yes. Right? And I'm getting pain in my other shoulder. Yeah. Because of it. Right. So a suggestion to change the load would be
to, I can't do it with my left arm, but between sessions I can pretend I'm doing it with my other arm. Just do something to do it a little bit different.
And then give
And be more
yourself
aware of how
recovery.
I'm sitting down.
Yeah, giving yourself recovery.
Okay.
Yeah.
Okay. All right. Thank you.
Yeah.
It's loading.
All right. So anyway, I was intrigued because I thought, okay, well, that's kind of been our go-to. And so we need to look at the whole system and how it's working together. What's happening with the muscles that attach around the pelvis and coming up. Now, what we know about our connective tissue is we have these lines of connective tissue in our body. And so this idea of one muscle, it's just one muscle, or it's just one joint, that's not how the body works.
Yeah.
It's how everything is working together. And so when I started to read and digest a lot of the stuff that she shared in her blog, I was just like, boom, I started really applying all of these principles and got really excited about it and started doing online training. And then I found out she was doing a training in California. And so I did that every month for 7 months. And as I was applying these principles and sharing them with my clients, I was just sharing the principles at first from the blogs. I wasn't even planning on it, but my pain went away, and I wasn't trying to get out of pain.
Right, that wasn't your goal.
That was not my goal. My goal was to just learn something new and just start applying it. And what started happening was the pain went away, and I stopped leaking urine.
Wow. That was
so really
be an experiment that you didn't even know you were doing.
So the experiment was applying a different load for that random leakage, and I ended up getting out of pain. So then I became a cheerleader, really, for how are we moving and using our body day to day, and how is that maybe taxing our system? And the way I look at it, and I describe to people is, okay, so you're leaking urine. Here are some things that, if you can bring awareness into your day, what's happening internally? What's your pressure system like? Why is there a lot of pressure down on your pelvic floor? Because if you have pressure down, there's going to be a natural reaction to the muscles to try to support that.
Right.
So we have this increased tension, increased pressure, and then how can we use our body to support this system so that our muscles can be on and ready to go? Because what we tend to do is tighten. Tighten is only one aspect of a muscle function. We have a shortening and we have a lengthening. Now, imagine if we're going to be pulling back to try and shoot a rock with a slingshot. We want lots of length, don't we?
Right. Yeah.
To really shoot it for force generation. And this is what we want for our muscles. We need this lengthening so we can shorten. And this is what I think can get missed in our day-to-day, because we want ripped abs. We're going to be doing our planks. We're going to be doing our crunches. And we're going to be working so hard and going above and beyond what our body can do that we're putting pressure into the system.
Right.
And we're potentially jacking our systems up and overusing. And we've forgotten how to finesse our system. To be reflexive and to be responsive. You know, what I see in our culture is this push, 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 push mentality. And then I see it in the body. Men and women. Men and women.
So what you're saying may be part of why we're seeing a rise in yoga and things like Feldenkrais, right? Because well, even some yoga is a push, right? So
well, what's awesome right now is a lot of these esoteric practices, yoga, acupuncture, we finally have the means to research them effectively to make them scientifically valid. And so now, kind of the buzzword in our world is trauma. We want to be trauma informed, and what we know about trauma in the body, and this is little t trauma to big T trauma, meaning, watching, a dog get hit on a car, that's traumatic, and then also living in this world, even driving is traumatic, right? So we're bombarded with our nervous system.
Everything becomes overwhelming.
Right. And so what's happening, what we see now with some of the big names in trauma, Stephen Porges and Bessel van der Kolk, is we want to affect the body from top down, meaning brain out, and then bottom up. So we somatically, this movement is releasing some of this stored emotion or stored neural bundles. However you want to look at it. It allows the body to express and get this out of the system. And so movement is so key. Like when you're dealing with chronic pain, the top two most effective ways to get out of pain is number one, education. How does the system work? Number two is movement or exercise.
Right. Okay. That's it's wonderful to hear that, because most people would say number one is take a pill.
Right.
Number two, take a pill.
That's right.
So I love that you're really educating and teaching people that the pain didn't come because we lacked a pill.
Right.
This is not from a lack of Tylenol.
Right. It was so funny. The other day I was shopping at Whole Foods and ran into someone who I had seen in Compass for a few times, and she said, "You know what, Susan, those exercises that you gave me for my hip are just so awesome because they help with everything. Like I had something, I tweaked my back or something, and I did the exercises right away, gone." And that's what's exciting to me, because self-care is so important. There are a lot of different modalities out there for self-care. Mm-hmm. So sometimes just going, okay, I'm going to pause, I'm going to reset. And I don't feel like we give ourselves permission to reset.
And it's major. So there's two things there. One is that the fact that it's so immediate is important. Because if somebody's in pain and they've got to do this exercise for 3 weeks before they get relief, they're going to go to the pill, which is going to happen. Mm-hmm. But the fact that she was able to do it and immediately feel a shift, that's huge. That's going to help keep her doing it, and hopefully help anybody that's listening when it comes to remember some of those things are, because it can work immediately. Yeah. And the second piece is the reset. I just recently heard a naturopath giving a talk about how when you're sitting at your computer doing anything that stresses or loads the system, the brain, to stop every 20 minutes, every 40 minutes, every hour at the most, and even just take 5 minutes and allow that whole stress mechanism to stop for a minute and reset. Yeah. It makes a huge difference.
Yeah, and that's, I was thinking, that might be a good way to just kind of wind things down for us today. This is why I love using breath as a means for a home exercise, because breath is the bridge between the core, right? So when we breathe, we have movement in the diaphragm and the pelvic floor, and they're moving in opposition. So we have this lengthening and shortening. Abdominal wall is lengthening and shortening. Now, if you imagine how often we're breathing in a day, it's a big workload, like 30,000 times a day. This is perhaps a missed opportunity, because someone a long time ago told you that you needed to tighten your core to be strong, and that's bogus. That's not, if that's happening for you, stop right now, because we need to be in a relaxed state in order for the muscles to respond. Right. If I'm moving like this and I'm already tightened, first of all, if I'm tightening around the core, it's going to limit my motion. Yes. So we want responsiveness in the system. So if we can breathe and access this pressure system, building this appropriate intra-abdominal pressure, finding and connecting, this is where we get our strength. So if we bring that breath in, an intentional breath, then one second, and this doesn't mean Buddha breathing. This doesn't mean, we do this big breath. It's not about that. It's get it there. Get it there. Allow it to lengthen, allow it to shorten. You have this subtle movement, and this is what we want.
So give us a quick exercise. So we're breathing into our nose and out through our mouth?
I like nasal breathing, a closed circuit. We want the biggest, the most effective. Less is more on all of this, because one of the things that I found when people have a hard time, because they've been holding their muscles in so much, they don't know how to let it go. A lot of times, a cue that I'll give, and I learned this from a training that I went to, Lois Laney. She, her workshop is called Restorative Breathing. I would highly recommend it. She goes over silent breathing. So one of the things that you can do is plug your ears. you're going to put your tongue on the roof of your mouth, kind of that bumpy spot. And when you take that first breath, notice how loud your breath is in your head. Now, what you want to do is you want to adjust your breath so when you breathe in and out, you don't hear your breath. And you do that for 2 to 3 minutes. So that gets us into getting that balance in our nervous system. And then if you're wanting to go into really going more into that relaxed response, which is in our nervous system, we have sympathetic and we have parasympathetic. Sympathetic is what we know is fight, flight, freeze. Parasympathetic is rest, digest. So a lot of times what we're trying to do is we want to balance the scales. So we want to even go into more of that slow. So we can do things to affect that vagal nerve and improve our vagal tone. So a longer exhale. We can hum. That's why chanting can be really nice. We can sing. We can also enhance our vagal tone by facial expressions and fake smiling and smile, and that releases oxytocin. So we have all of these things that we can do, but this breath is 2 to 3 minutes. So if you're going to inhale for 2 seconds, let your exhale be 4. So you're going to double that exhale. And this gets us reset nervous system, and you're moving your pelvic floor. So pelvic floor and abdominal wall. So what we're trying to do is this reset where we're letting everything flow. So we're getting better circulation, we're getting blood flow, we're getting oxygen delivered. Because a lot of times what's happening is the autonomic nervous system is kind of mediating this. So we're not getting as good blood flow. So we get this cycle of tension, and it kind of hangs out in the system. So as I'm talking, I'm kind of raising my shoulders. It's like, okay, let's just take a few minutes and just do a little check-in. So that would be a closing point that I would recommend.
Yeah, and so you're talking about 2 to 3 minutes.
2 to 3 minutes.
So to stop and reset 2 to 3 minutes a few times a day. By the end of the day, I imagine that there's a completely different feeling. You don't have that exhaustion, or you don't have that hyper stuff that doesn't even let you relax when you get home.
Yeah, huge.
Yeah, wow. Well, I want to thank everyone that joined us. We had a lovely group here, and Diane Miller just shared the video and says, let them know you appreciate it. So thank you, Diane. And thank you all. Steve was here, and Eva and Sarah. I haven't seen you guys in ages.
And what I'm going to have Paula, she's tagged my personal page. We're going to put the link to my business page, and that has information of where I'm located in the valley.
And we can schedule online. What is your website? Give us some contact.
Yeah, so my website, you can find me at alignforhealth.com, and that's ALIGNFORE, FOR and health.com. So Align for Health, and my business name is Align. I'm here in Salt Lake City, and we'll link those in the comment section.
Yeah. Thank you.
Okay.
Susan Mclaughlin, that was delightful. Really wonderful information. Yeah. And you can reach me at Paula K Bronte at Gmail, and I'm at www.intheblink-of-an-eye.com. Thank you, everyone, for joining us again. Hope you have a lovely week, and reset every day, 2 or 3 minutes. Bless you. Bye-bye. We'll see you next week.